everyone, and thank you for joining us. We're really happy to have you here. And for those of you who don't know me, my name is Kimberly Connell. I'm the Caregiver Support and Services Specialist with Onondaga County Office for Aging and Long-Term Care Services. And on behalf of the County Office for Aging, I'm pleased to welcome you all to the very first Institute for Caregivers class of 2021. This is the Oral Health and the Caregiver. And in developing this topic, we asked a couple of key questions to caregivers. And number one, has the time come, or do you see it coming, when as a caregiver, you are relying more and more on your own knowledge and skills to do for your loved one what they can no longer do for themselves? And number two, is proper dental hygiene one of those caregiver tasks that you may not be prepared for? And the answer was a resounding yes. So we were really excited when our presenter, Margie Vensel, came to us with a proposal to present a class on this very topic. So we're really happy to have Margie here. And we do intend for this class to be interactive. And so we welcome any questions that you have throughout the presentation. So please don't hesitate to ask. And although you're muted at this time, if you have a question during the presentation, you can raise your hand using the reactions icon on your screen, or you can put a question into the chat and I will relay that to Margie. So now I'm delighted to be able to introduce Margie Vensel to you. I want to tell you a little bit about her. She has been a registered dental hygienist for 36 years. She's a graduate of the University of Pittsburgh School of Dental Medicine, and she also obtained a bachelor's degree in dental hygiene from the California University of Pennsylvania. So Margie has worked in private practice for her entire career, but she's always volunteered in communities where she lived by providing dental health education to area schools and to groups. So she's also a volunteer with the New York State Dental Demonstration Project, where she volunteers to provide dental care and education for underserved populations in New York State. And she's currently enrolled in a certificate program to become a community dental health coordinator. And the role of the coordinator is to provide dental advocacy to underserved groups and to conduct community outreach activities on the importance of proper dental hygiene. Margie's also the founder and administrator of the Hygiene Study Club of Syracuse. I don't think she'll have time to tell you about that, but it's really a fascinating project that she developed. And she also serves on the Marcellus School District Board of Education, along with many other volunteer roles that she does in her community. She's extremely active. So we're really, really happy to be able to have Margie with us tonight. So without further ado, I'm going to turn you over to Margie.
Sorry.
No, thank you.
Yes, I appreciate it. What I was saying is we were planning on doing a pre-presentation survey that didn't get out. So I have the survey on the screen. I realized that you aren't able to see the screen in detail. Unfortunately, this is the only way that we could present this. So I will be saying everything on the screen, so I don't be missing anything. On the survey, the most important question that I just want to ask you right now, and just answer it in your mind, is I feel very confident in taking care of my loved one's mouth. On a scale from 1 to 10, 1 being not confident, 10 being very confident. Just, I'm interested to see where do you fall in that. The goals of my presentation are, I want to talk about the health concerns related to oral health, why it's important, identify the needs of the patient. We'll talk about home care. We'll talk about dry mouth. And we'll also talk about pH and the also talk about visiting a dentist for a compromised. But first, I would like to first talk about how your mouth and your body are connected. There are several, for years, your mouth is your mouth and it doesn't matter. But we're finding a much more Research has found an association between gum disease and rheumatoid arthritis, heart disease, diabetes, and we'll talk a little bit more about that. Some examples of the dental medical link: diabetes. Diabetes, when you have diabetes, you delay in healing. So you have an abscess in your mouth, or you have a lot of bacteria in your mouth, your body is fighting harder to take care of that bacteria. Heart health is a big one. The more bacteria in your mouth, it leads to an increased bacteria in your bloodstream, and it can wreak havoc and cause very much heart problems. Another problem is aspirational pneumonia. This occurs quite commonly with people who are bedridden, people who are maybe in an assisted living, or just have mobility issues. Their lungs are not as functioning as they had been. If their mouth isn't taken care of, they have a lot of debris in their mouth. A lot of times they'll have food and a lot of plaque, and they inhale that. They're coughing a lot, they inhale it, and they get aspirational pneumonia, which can be very deadly. So that's very important for people who are in very limited mobility. Another thing is untreated dental issues. An example of that is, say that you are a diabetic. You have a sore on your leg. Now you have an abscess too. Your body is fighting two different things. So what you want to do is, keep your mouth healthy. Your body can take care of everything else. Rheumatoid arthritis, you get a flare up, your inflammation, you have a bad tooth, your body's fighting, it's sharing the fight. And if you get, I can't tell you how many people that will say they get their dental problem taken care of, they can't believe how good they feel. They didn't know they were run down before. So it's really an important thing to keep on top of your dental. An example of how your medical health affects your mouth. Asthma is a really good one. People with asthma, you're using the puffers. That puffer, it leaves a coating in your mouth. If it sits there, it changes the bacteria in your mouth. It also dries your mouth out. Acid reflux is a big one also. And untreated acid reflux, it leads, the acid comes into your mouth. It's just laying on your teeth. I had a patient who had untreated acid reflux for probably about 4 months, very healthy, 45-year-old. And we were shocked when we took an x-ray and saw the root eroded. So it's very important to be aware of acid reflux. Sinus issues is another thing. The sinus issues, you get a lot of drainage, you get a lot of bacteria in your mouth. A lot of people complain to us that they have a bad taste in their mouth, or they feel like they have bad breath. Most of the time, that's either coming from sinus or the stomach from reflux. So those areas need to be treated to help your mouth. Sleep disorders is also a common one. When you are, if you're a snorer, compound that with sinus issues or breathing, you're sleeping with your mouth open, and that causes an increase of bacterial growth in your mouth as well. Next, I want to talk about identifying the needs of the individual. And before I get into that, I do want to say we have a vast range. Vision. Some of you have to totally do everything for somebody. Some of you may not have that need yet, but want to be informed. So I'm going to kind of try to span the whole gamut. Just bear with me if some of this doesn't pertain to when I say about the individual needs of the person. Talk to their dentist, seek routine dental care, ask them. One thing that led me to do this is increasingly in the past few years, I have had so many people, contemporaries of mine, all of a sudden taking care of their parents, and they're like, what do I do? I don't know. They don't even know what they have, what their parents have in their mouth, which is common. I mean, who knows, do they have dentures? Most of the time you know if they have dentures. Do they have partials? I've had people come in and they're like, what is this in my mother's mouth? And, I had to show them how to take care of the partial. Do they have bridges or implants? A lot of people have invested a lot of money in their mouth, and then it's neglected and they lose it within months because of lack of care. So it's very important to know what's needed. Ask the dentist or the hygienist, what's the condition? Are they pretty good? Are they really bad? And are we just trying to maintain things? What's going on? Are there certain areas that need special attention? Sometimes they'll clean the right side of their mouth better than the left. Find out. Sometimes they have one lone tooth in the back they forget about and don't clean. So just find out. I put on here about having frequent exams and cleanings. As health declines, it gets more and more difficult to get to the dentist. And also the increase of need happens too. So you will not regret getting 3 cleanings a year, 4 cleanings as opposed to 2. If you start now healthy, the decline will be much, much slower. Also, ask a professional, what are good products to use? I'm going to go over a lot of products. Some are good for some people, some aren't. So ask them what they recommend. I just want to show you, these are some examples. These are dentures, partials. This is an example of somebody who has a lone tooth up there. You may not know it because you just see that. This is an example of their teeth look fine. They have a huge infection. Their body's fighting that infection. So this is an example of somebody who has thousands and thousands and thousands of dollars worth of work done. These are dental implants. These are crowns, bridges. They certainly need certain care to take care of that. I'm sorry. So let's talk about, what do you do? What do you do at home? What do you do at home care for the compromised individual? We'll talk about denture care. We'll talk about brushing, cleaning in between the teeth, and mouth rinses. So dentures and partials, dentures are, and excuse me, I'll just come up. Dentures and partials are removable in the person's mouth, and they, it goes for a variety. People have different types. It's important to remove these daily. You want to make sure that you have the denture and partial taken out at night. I always say it's equivalent to sleeping with your shoes on. That tissue just needs a break. You have to let it breathe. You want to get that plaque and bacteria out of there. It's best to use a denture cleaner. Toothpaste and toothbrush is often too abrasive. It'll put little micro scratches in the denture, which then harbors bacteria. So the little denture cleaners are perfect to do that. A clean denture helps irritation. If you have a lot of stuff on the denture, it's almost like getting a pebble stuck under there. It hurts. It hurts. So denture patients should have professional visits too. We really only recommend that once a year. What the dentist does is he checks the tissue, or she checks the tissue and make sure it's healthy, but also we professionally clean the denture. We have a solution in a machine that does a very good cleaning, so it's well worth it. And we also can tell them if they're having a sore spot or if it needs adjusted or anything needs taken care of. So it's important to get a denture patient checked once a year as well. The denture adhesive, I'm going to talk a little bit about adhesives. Adhesives are, they're used to hold a denture in place. Oftentimes on medically compromised people, their tissue shrinks. When you first have your teeth out, your tissue and bone is at a certain height. Well, 30 years later, that bone and tissue shrinks down and you don't have the fit that you had. Add that to a compromised individual who's somebody, you know, if your health is declining, you often lose weight, that denture becomes very loose. So you may need to use an adhesive. It will hold it in there, but also you need to be aware of how to apply adhesive. You don't put a whole lot on there. What you do is you just take your denture and you just take and put a line of adhesive, maybe one, just a little bit. You don't need a whole lot. If you do need a whole lot, there's something wrong with the denture and you may need to have them look at that. Getting a denture in and out, let me get my tooth models here. When you get a denture out, to get an upper one out, if you first apply pressure to the front and just kind of torque, that torques it and loosens it from the palate. And then what you do is you put your fingers in the mouth, you'll have them closed down. Most people want to open real wide whenever anybody's working in their mouth. That actually constricts the muscles. So when you get your fingers in there, have them closed down. That releases your muscles and you're able to reach it. You touch the ridge of the denture, pressure on one side, pressure on the other side, it pops down. Same thing on the bottom. And the same thing with the partial. So a lot of times it takes a little practice, but also another tip is if the person uses adhesive, if they use if you have them rinse with some warm liquid, warm water before, that loosens the adhesive and you'd be able to get it out. I already went over that. That's steps in removing the denture. And again, you know, you rinse it off. Here are some products. These are some common products that to use for denture care. These over here are the cleaners. You put your denture in a cup of water, put a tablet in there, and it cleans them. These are some samples of adhesives. And this is an example. This is an ultrasonic bath. That helps to clean the denture. This product it's probably about $30 at Bed Bath & Beyond. It's a good product. Again, first of all, I don't work for any companies. These are just some products that I know that patients like and that they work. And I'll mention several other products like the denture bath. It's only as good as if you use it. It's not worth the money if it's going to sit on your counter. It's well worth it if you're going to use it every day. So that is those are some good options for denture care. So let's move on to taking care of natural teeth. Whenever we're talking about taking care of natural teeth, we're talking about brushing. We're talking about cleaning in between the teeth. We'll talk about mouth rinses, and then we'll talk about a few other products. Now, with brushing, as you know, and if you've been to the drugstore recently, there are a million kind of brushes out there. I'm going to first talk about mechanical brushes. Mechanical brushes, and here's some examples. These are one of the very best products out on the market, the Oral-B and the Sonic Care. Those are rechargeable mechanical brushes. My only hesitation with recommending these for compromised individuals are, especially if your person has sensory issues, these are excellent products, but they're not for everybody. I have a sample of the Oral-B, and I'll just turn it on, and you'll hear it does a great job, but it does provide quite a bit of vibration. And sometimes this is just too much for somebody who has compromised health, especially if they have memory problems or have sensory issues. So you may want to steer away from this. Like I said, it's a fantastic product, but it may not be the perfect product for your loved one. Another type of spin brush is the battery operated one. This may be better for you. I like the mechanical brushes because they do all the work. They remove the plaque, they do a really good job, but this one is not as powerful. So if your loved one can handle some vibration and some motion, you may have somebody who you're lucky to get your brush in the mouth. This is not for them. But if this is a very good option for somebody to, if that's the case for you. The other brushes are the standard manual brushes. Like I said, you go to the store and there are a million different kinds. Soft bristled only. I can't tell you, I know, I hear everybody loves medium or hard. Soft bristled, what you want to do is massage the gums, get the plaque from in between the teeth and the gums. The soft bristles can flex, get into that area, and remove the plaque. So soft bristled only. Now, there's a million different kinds of those. So there are a lot, I have some samples. You may have to adapt the sizes. This is a regular adult brush head. So that's your regular.
What?
This is
Really?
a junior size. And this is an infant or child size. This is from 0 to 5-year-old. This is 5 to 12-year-old, and then this is 12 and up. Especially if you have an individual who's kind of shrunk and is tiny, they can handle it. There's nothing wrong with using a small brush. So whatever brushes fit the need. Now, for people who have a hard time holding things, there are products on the market that help to hold things. This is an adaptive handle, and all you do is just put it on there, gives them something to grip and hold. I've seen tennis balls cut that they can hold it, and then that way they can get in. So think outside of the box, whatever works to get the job done. My favorite product for compromised individuals are these 3-sided brushes. Now, there's a few of them on the market. I looked on Amazon and I found this one. I don't know where my camera is. And in theory, it should work. These bristles are like plastic. I think this is just too abrasive. So beware of what you're buying. This product is called the Callus Curve, and I actually have slides, so I'm going to switch that. So this is the Callus Curve toothbrush, and what they do is it's set up with 3 types of bristles, or 3 separate areas of bristles. So we have the bottom one that cleans the chewing surface. This side curves, this side curves, and it's split in the middle. And I will show you, and I will use the black one so that you can see it. And what you do is you just push it and it
Perfect,
adapts,
perfect.
and it will brush both sides of the teeth. So it gets around. This one has an adaptive handle as well. And these bristles are just a little bit longer for people who have periodontal problems. Most older adults have some recession on their teeth and their gums. So this will help to reach and get in there. And there are various sizes. This is the periodontal one, which has a little bit of a smaller head when you compare it to this one, but it's, like I said, a little bit longer bristles. And I believe these two are the same, yes. So these are excellent products, especially if it's somebody that you have a hard time. All you have to do is get it on the tube and it will get it and it will clean both sides. Somebody that you have about 30 seconds or a minute to get in there, do that. Use that one. Here's a picture of how it works. You can see how it curves down, gets to that space where plaque lays. This is the most common place where gingivitis and periodontal disease occurs. So you want to get down into that area, and it does a great job. The downside of these brushes are they're a little bit difficult to find. The website is called a Callus Curve. So the website is calluscurve.com. They have email, phone number. They're also available on Amazon. So if you're interested in that, there's that resource for you. So the takeaway of toothbrushes is use what works best for your person. You may have to change. Maybe the spin brush works first. As their disease progresses, maybe they can't handle that anymore. Maybe you have to go to a manual brush. Maybe you have to go to a pedo brush, a child's toothbrush. So be flexible. Use what's best for them. Now, that being said, one thing I do want to mention is dry brushing. Dry brushing is basically you wet your toothbrush, brush your teeth. What you're doing is you're loosening all the plaque up without anything in your mouth. If you dry brush first, then wet your brush, put a little bit of toothpaste on, you're going to use like a pea size, brush your teeth, and then spit out. It's really recommended that you not rinse after you brush, just because get that extra, the toothpaste can work in there, the fluoride can stay in there. But the dry brushing plays a significant, it really significantly decreases the plaque. And a compromised individual can handle it better. So they're much more compliant. And it's really amazing, even though you rinse your brush off, you still have a little taste of the minty taste from the toothpaste. So it's not terrible. And the nice thing about that is you can do it a couple extra times a day. You don't have to do, you can just have the brush there, and sometimes it's soothing for the person. So our next step, talking about toothpaste, again, a million types of toothpaste out there. I'm not going to get into them. I'm going to say it's your personal preference or what's recommended to you by your dentist or your hygienist. They know your individual needs. There's sensitive toothpaste, there's baking soda toothpaste. Mainly, just use a pea size. You don't need a whole lot. And like I said, dry brushing is very, very effective. So, cleaning in between your teeth. That's traditionally done by flossing. It is very, very difficult to floss somebody else's teeth. And then added that they have limited opening or limited attention span or are stubborn and won't let you in there, it makes it harder. So flossing, of course, is best. Many of you may use these. And again, this is just an example. I'm not advocating for any certain brand, but these are Floss Picks, and they, so you use the handle, you can get in there. Sometimes they get it in and they kind of bite down and it snaps in between. The nice thing with these two, you flip it around and you have a plastic toothpick too. That massages the gums. If you have a place where food gets caught, that will get it out of there too. So these are good if you're able to get in there and do that for your person. There are a few other products to clean in between the teeth, and I'll show you those. So there are these Flex Picks, and what they look like are they're just little picks, and I know it's hard to see, but they're just a little pick, a little bristle at the end. It's almost like a rubber bristle. The thing is, they're flexible too, so you can bend them, get them in between. They're literally addicting. They feel really good. So those are a good thing. There's things called proxy brushes, and a proxy brush gets in between the teeth, and this is good for somebody who has an implant or a bridge. This proxy brush, this one is a disposable or a travel size, I'm sorry, and this has a very small bristle on it. I have another one. So they come in various sizes. Again, use what you need. This one is more substantial. This would be for someone who maybe has wider spaces between their teeth. This would be for somebody who hardly has any space. This one is a reusable one. This is a handle. You buy the handle and then you buy a bag of the bristles. And what you do is you just flip, this is a latch. You just flip it up. You put your bristle in, and I already used this, so it's hard to get in. And then you snap it into place. You get several uses out of them. When they get worn out or not effective anymore, you switch out. But this with the longer handle is sometimes a little bit easier for a caregiver to use. So this may be a perfect example. I will, this poor guy has all kinds of problems here, but you can see that this, it just gets right in between there at the gum line. So it will get hard to reach areas. And like I said, this is good to clean around implants and bridges. Other things to use, they're called stimudents. I don't have any samples of them. They're basically a dental toothpick. They are a balsa wood, so they're softer. Anything that goes in between the teeth and massages the gums. That's the same with a rubber tip stimulator. That does the same thing. As far as mouth rinses go, there are a ton on the market. Many do different things. Listerine is a common one. We see a lot of advertising for it. That's commonly used to control bacteria, to control gum disease. Closest is another one. That's more to soothe tissue. That will help if somebody gets a lot of mouth sores and things like that. There are dry rinse mouths. You really have to use what's best for your person and what is most compatible and what they need. There's a whole gamut. I say Listerine. It doesn't matter the generic of, as long as it says antiseptic, it does the same thing. The Listerine Total Care with zero alcohol, that's much kinder to the tissue. It's not as biting. So if somebody has some sensitivity in their mouth, that's a good product. Colgate Hydrus, this is more of a dry mouth rinse. Smart Mouth is kind of just coming on the market more, so it's coming more available. A lot of people love this. It comes in different types, the dry mouth, the original, and here's Closest. Closest has Closest Silver, which is for people 55 and up. So all very good products. Other products that are good. So Water Pick is an amazing product that works great. However, it's very, very difficult to navigate. It's probably really difficult for a caregiver to do that on someone else. If your individual is able to use it, it's a great product to use. If you do have a Water Pick, I highly recommend you go on waterpick.com. There is a 2-minute video, a how to use video. It is well worth your time. You will get much more use out of the product by using that. I wrote on here, show me. The reason is, as dementia patients decline, as Alzheimer's patients decline, they may brush their teeth today like no problem. Tomorrow they'll look at that brush and say, what is this? What do I do? You just have to show them. Be patient. This is your toothbrush. We brush your teeth every day. We brush your teeth every morning. This is how we do it. Just be patient, show them. I wrote down a mouth prop, and I will show you a mouth prop. I have several Alzheimer's patients who come in regularly who I have a really difficult time getting them to open. And so we use a mouth prop. In dentistry, we use a mouth prop like this. It's easy for us to do it because we have access. They're laying down, we have lights. That's probably harder for you to use. These are sensory issue bite blocks. You kind of get it in there and then turn it, and it props their mouth open. One of the easiest mouth props you already have is the end of your toothbrush. All you do is get it in there, they bite down, you turn it, let them chew on that. You brush this side, you get that side done, move it over, turn it, let them bite on it, and you're brushing the other side. That's probably the easiest thing for you to do. So just just prop them open, that way you can do it. Remember I said, the wider isn't always better. It contracts their muscles. So if you can get them open a little bit, you can get the brush in there and do a good job. So some tips to get this done. Again, we have a wide range of needs that I'm addressing. Some people, you just say, brush your teeth, and they brush it. If you as a caregiver have to brush their teeth, it's often better for you to be eye level. You don't want to be coming down on them. What are you going to do, babe? And it's often good to be beside them at the same side so that you're brushing like how you would your mouth. And it's very difficult to come at a different angle. If you have someone who they really don't want to open, just kind of massage their cheek. You want to massage their cheek, and they're getting more comfortable. And then you finally get your finger to the corner of their mouth, slip it in there, just rub their gums, do a little gingival massage. That's equivalent to getting your hair scrubbed at the hairdresser. It feels great, they relax. Then get them to tip their head back. When they tip their head back, their mouth drops open. You get in there, that's when they're relaxed, you have their head tipped back, you get in there, get that toothbrush in there to prop them open, go to town. I was a hygienist for 10 years before I had any children, and I used to tell people, start on the upper right, do this motion. After I had kids, I was like, are you kidding me? No wonder they looked at me like I was crazy. Get in there, do what you can for the 30 seconds, minute that you can. Anything is better than nothing. Use the bite block if you need to. Some patients I have some special needs patients who they just gag the whole time. And one little tip is you just use a dab of salt. What I do is I rub my finger on the inside of their cheek. I have some salt on a paper towel. I dab it. I have them stick their tongue out. I touch their tongue with salt. I'm not using a lot. You will be amazed. I have never had anybody that gags that I wasn't able to take x-rays on. It really, really helps prevent gagging. Another thing to do is the pressure point for gagging is you're squeezing your thumb. Have them squeeze your thumb. You're brushing, they're starting to gag. Squeeze your thumb, and they'll get that taken care of. You'll get it much easier. Just keep trying. You'll have good days, you'll have bad days. Some days they'll be cooperative, some days you won't be able to. If you have a bad day, go back the next day. Keep trying, you'll get it. Now, I want to talk about dry mouth. And I know we're kind of getting on time, but this
Okay.
is such an important side effect. It really enhances the chances of dry mouth. It's also a side effect of certain diseases like Sjogren's syndrome or autoimmune diseases. If you have somebody who's had radiation or chemotherapy treatment, that dries your mouth out. Age, as we get older, our salivary glands obliterate. Other health issues. So, like I was saying, asthma, mouth breathers, sinus issues, those people often have a terrible dry mouth. This is, and I don't expect you to read it, but this is a chart of medication, some of the medications that list side effects as dry mouth as a side effect. You can see how extensive it is. So the chances that your loved one or you are on one of these medications is very high. So dry mouth is something we really need to be aware of. Some of the solutions for dry mouth: stay hydrated, drink water. Sometimes, especially with a medically compromised individual, that's just not enough. You can drink and drink and drink, and their mouth is just so dry, and it becomes so painful to them. One way you can tell with dry mouth, they may not complain, but are they biting their cheeks? Are they biting their lip? Did you notice food stuck in their mouth? If you see food stuck in their teeth, a lot of times that's because they don't have enough saliva to rinse it out of there. So look for things like that if they don't complain about it. You can use over-the-counter oral moisturizers, sprays and mouth rinses. You can use sugar-free gum and lozenges. It's best with xylitol. I'll talk about xylitol in a few minutes. Use a humidifier to keep moisture in the air. I don't know about you guys, but as people age, I know it's like the Sahara at my mother's house, sorry Mom, but it's so hot in there and it's so dry. Use a humidifier. Avoid foods and drinks that irritate the mouth. Carbonated drinks, acidic foods, tomatoes, that burns the tissue whenever you're dry. And your dentist may recommend you use a fluoride to protect the root surfaces from cavities. Excuse me. The root surface it's not covered with enamel. Most of the times you'll get, as we age, we get a drier mouth, we have recession on your gums. Next thing we know, the plaque is just laying at the root surface, and it just literally, it's almost like chopping a tree down. It just wears in there. My brother was medically compromised for years. He had mobility issues, so he didn't go to the dentist regularly. He took a lot of medications, a lot of pain medications that really dried the mouth out. And as his health declined, next thing we know, his teeth are just snapping off. And what happened is the decay just happened at the root surface and just undermined everything. And then then you're dealing with something that you need to deal with the general health more than the broken teeth. So those are some things to be aware of. So products. Like I said, water is not always enough. Think about products that are for dry mouth. Here are some examples, and excuse me, speaking of dry mouth. So these products are just some examples. There's a lot out there. ACT, which you may remember, we always recommend that for kids. They've expanded their line. They have a dry mouth product. This is a mouth rinse, and you can see it says with xylitol. These are lozenges, and this is gum. So if your individual is able to chew gum, how great is that? Let them chew gum all day, and you're getting xylitol, you're moisturizing the mouth. Hydrus is another one that's a good mouthwash that helps to hydrate the mouth. Biotin, the Biotin line are great products too. The mouth rinse, this is a moisturizing spray. There's toothpaste, there's gel, and there's lozenges. So some people may not be able to rinse. If that's the case, you may want to try a lozenge or gum. This mouth spray is an excellent product also. A lot of our patients keep it at their bedside table. They wake up at night, they don't have to get out to rinse, put a squirt, they'll keep it in their purse. Just keep it in the car. You just need a squirt of it, and it stimulates the saliva and moisturizes your mouth. Again, these are all great products. The Xylamelts are an excellent product too. I would say that the Xylamelts maybe are for people who have maybe a more severe dry mouth problem. Again, these aren't the easiest to find. A lot of times, I know for years Rite Aids carry them, but you have to talk to the pharmacist. They're not a prescription, but they're harder to find. I know you can find them online. What they look like are they're little tablets, and you can see from the pad here, there's a light side and a dark side. The dark side actually adheres to your tissue. So I normally have people just take it, they put it up in their, we call it the vestibule, in the space up above the teeth, and put pressure on it for 5 seconds, and it sticks there. It does not come off. What happens is it slowly melts. So these are excellent for somebody for sleeping, because all night long that just melts, and it keeps hydrated, you keep wet, and so these are really good products, especially if you have somebody who can't physically do the mouth rinse, the lozenges, or the gum. So Xylamelts, if you remember that, that's a great product. I briefly mentioned xylitol before. Xylitol is often in the dry mouth products because what it does is it, my slides don't want to advance, there we go. And I'm not going to read all this, but basically what it does, it's a natural sweetener. The bacteria can't tolerate it. The bacteria in your mouth eats it, it kills them. One thing I didn't talk about is, and actually I'll talk about it later, because as we age, you kind of crave the sweetness. These are some products with xylitol in it. The Spry brand is a very good brand. The concentration of xylitol is excellent. So these are good products. Again, a little more expensive, a little harder to find. Icebreakers, over-the-counter mints, you get them at the grocery store, that has enough xylitol in to help. One thing I did not read that I want to make sure, is xylitol is very, very dangerous for dogs. More dangerous than chocolate. If you have a pet, please be aware of that. If you have any of these products, please keep it out of reach for the dogs. And I have a question, so let me.
So the question really is, what exactly is xylitol and the benefit for dry mouth? Is it a benefit for dry mouth or for bacteria?
It's a benefit for both. So and when I do this pH, we'll talk about it a little more. The xylitol it kills the bad bacteria and it lets the good bacteria, and we're going to talk about that. There's all kind of bacteria in your mouth, good bacteria, bad bacteria, and the ones that we want, the ones we don't want that causes the problems, the xylitol will kill.
Wow.
The pH of the mouth is very important. I talked to you earlier about acid. You lay it on it's laying on the teeth, it leads to decay. The most common place for decay in older adults is at the root surface. Somebody who has had extensive work done, crowns, bridges, you still have your veneers, any of that, you still have your tooth underneath there. That porcelain is not going to erode. Nothing's going to happen to it. But guess what? That acid gets up underneath it, it undermines it, and people will lose a crown because of that. So it's very important to not only worry about the plaque on your teeth, but also what is bathing the tooth. This is a chart that talks about pHs. So neutral pH is 7. As we go down the scale, it becomes more acidic. A 1 is battery acid. So as we go this way, it's more basic. So we have baking soda over in here. After about, I think it's at 5, that causes more decay. It's not great for the teeth, but the body can overcome it. The tap water is the best thing for your mouth. It's basic, it's grape neutral. Fiji water and Floss water are two of the only bottled waters that actually have a neutral pH. Look at Dasani. Dasani is 5.4, so it's pretty acidic. I mean, that's borderline on causing a lot of problems. What they do is they do the minerals added. When they add the minerals, what they're doing is they're changing the pH because the more acidic, the sweeter it tastes. So the sweeter it tastes, the more you crave it. People who drink Dasani only drink Dasani. They don't like this other water because it doesn't taste as good. Well, you know why? It tastes sweeter. And any of you who have aging family members or are a caregiver for an aging person, they crave sweets. That's all they want is sweets. And it's because they can't taste as much as they used to. The roof of your mouth is covered, it has taste buds as well as salivary ducts up there. And you wear a denture, you don't have as much taste. People with dentures eat more sweet things because they can't taste it as much. As people age, they want sweet things. So it's really hard to combat that. So you kind of have to try to get them out of the habit. I do want to point out a few things. you know, coffee and orange juice always gets a bad rap. It's about a 5. It's not great, but it's not terrible. The tea is closer to a 6. I'm not sure exactly. I think it's like a 6.5. As you come down, you see Gatorade is 3.31. That's why teenagers, they drink a lot of Gatorade, a lot of Decay. This is vitamin water, 2.5. Very, very acidic. I always drank the Lipton Diet Citrus Tea. It's great for you, right? No sugar, diet, tea would be great. It's about 3.2. So I switched to regular unsweetened iced tea, and that way just to head off problems. So pH is very, very important. I'm not saying that you can't have this stuff. It depends on how you're drinking it. Do you have a Coke that sits there and you sip on it all day long? When you're sipping on it all day long, you're constantly bathing your teeth in that sugar and acid. You're better off just drinking it. You know, you drink 2 cups of coffee in the morning, that's fine. You know, rinse out with water, brush your teeth, you're fine. Same with orange juice. It's that constant all day. It's that sipping on it. That's what you want to limit or pay attention to. Get them in the habit of sipping on water rather than something like that. I already talked to you about this root decay. It's not covered with enamel. It dries your mouth. You have dry mouth, you have medications, you have acidic food. Next thing you know, you have tons of decay. This is a product out there that helps to neutralize the pH. It has arginine in it. This is like I was talking about with the xylitol, what they do is they battle the good bugs and the bad, these are the good bugs, the bad bugs, this is the pH system. You have these basic bites, and what they do is they kind of bathe the teeth and they help to neutralize the pH. They're sugar-free and gluten-free. They're a little bit expensive. It's about $20 for a month's supply. You use 2 a day, 1 in the morning, 1 at night. You do it after you're brushing so that it's in there. It really helps to crave for the cravings, the sweet cravings. I'm not really going to go into this much, but just be conscientious of snacks that you're choosing for your loved one. It's very easy to give them a cookie. You know, how about an apple cut up, or cheese, or hard-boiled eggs, or yogurt. Any of the anything that's healthier is way better off. One thing I do want to mention to neutralize your pH, you want to drink tap water. Watch how much acidic foods that you're having. Also, if you, a cheap, inexpensive way to neutralize your pH, add, I'm talking a pinch of baking soda. Take a pinch of baking soda, put it in their tap water. They don't know what's in there. It's neutralizing the pH, and it's beneficial. And I know we're running long. I just want to go over visiting a dentist. Working with your dentist is so important for caregivers. There's a lot of things to consider. Is your office handicapped accessible? Are the doorways wide enough to accommodate a wheelchair? Will the patient be able to stay in the wheelchair, or do they need to be transferred, or are they transferable? I know, and is it quiet? Do they have a private room? Some offices have an open concept. That's a really hard thing for people who have sensory issues. So it may be better off to find somewhere where they do. I know at our office, we have a handicapped room. First of all, it's the first room as you come into the office, and the doorways are wider. The room is twice the size of the other operatories, And what it's designed to do is, so the dental chair is facing this way, but what we can do is we can put the wheelchair in, turn them around, the headrest on our dental chair flips around, they can stay in their wheelchair and lean back. All of the equipment comes, it swings beside the hygienist or the dentist. And so we have enough room. That room also has a door to it, and I have volume control for the music and for outside noises. So those are things to consider, because it's very sensory issues. You want a calming experience. I also wrote on there, do they do teledentistry and do they take your insurance? You know, there's, again, a wide range of needs. That's up to you to talk to the office about. Teledentistry is fairly new. That's one good thing that has come out of this pandemic. It had been around, but it wasn't in the forefront. It is something where your mother broke her tooth off, and it's excruciating. You need a referral to go to an oral surgeon. So you call the dentist, you have to bring her in, get the referral. How about if you call the dentist, my mother broke her tooth off. She says, the dentist says, can you take a picture of it? Shine your phone and shine your light in there, let me see it. Oh yeah, it's broken under the gum line. I have her x-ray. I knew it wasn't gonna be great. Let me give you a referral. That just saved you from having to take your mother into and go through the hassle of getting her into the office. You know, a sore in the mouth. Sometimes, you know, it's killing you. You look, it's a canker sore. We can give you a prescription for that. You know, so talk about teledentistry, and that may make life a lot easier for you. Tips for a successful visit. I love when people, caregivers, call the office beforehand. Tell me what I'm dealing with. They're nonverbal, but they totally understand you. They're nonverbal, but they don't understand anything. They complain constantly about the right side. Whatever, just let us know what we're dealing with. Even long-term patients, you know, a wife will call and say, he's really, really having dementia problems. So just be aware of that. You know, you may make the appointment with him, but let me know. Caregivers, make sure you are on their HIPAA form at dental offices too. That's very important. You guys are all really good about medical offices. Make sure that you're on the HIPAA form at dental offices too. Be aware of the time of day. I prefer a special needs patient, my last one before lunch, my first one after lunch. They're normally fresher. I have more time. I don't care if it takes me into 15 minutes into my lunchtime to get them out of the chair. It doesn't matter. At least I'm not rushing, and they're more comfortable. Same thing with before lunch, or if they're the first one after lunch. They have time to get in there. Please have them prepared for the appointment. Have them empty their bladder. If they get in the chair that took them 10 minutes to get into, and then a trip to the bathroom could be another 20 minutes, when we have 45 minutes to an appointment, that's half the appointment. So please do that. Let them know what they're doing. You're going to the dentist tomorrow. You remember Margie, right? Remember how Margie cleans your teeth? That's what we're going to do tomorrow. You know, you like this, you know, just make sure that you reinforce it. I just want to throw out there, your dentist or hygienist may recommend a fluoride varnish. It is very beneficial. The cost of a fluoride varnish treatment is anywhere from $20 to $30. The average price is $25. It's well worth the money. It seals off the root surfaces to prevent decay in between visits. Another thing is the dentist or hygienist may prescribe an MI paste or a sodium fluoride paste. They're prescriptions. use it if they recommend it. This is a map of Onondaga County. This is where I've been at Dr. Fallon's office for 15 years, Fallon and Fallon Family Dentistry. We're general dentists. It's Dr. Michael Fallon, Dr. Anne Marie, and their son, Dr. Mike. And they're in Callus. Cicero Family Dentistry is an awesome office. They do sedation dentistry there. They have nitrous oxide and they have conscious sedation. So if you have somebody that you absolutely cannot get to do any work done, that would be a good resource for you. Dr. Zepp and Dr. Schellish, they're over in DeWitt. They're also a nice office, handicap accessible, wide doorways, things like that. There are dental clinics in Syracuse, Upstate Dental Clinic, St. Joe's, VA. There's also Syracuse Health Center that has a very good dental clinic. They accept Medicaid there, so that's a good resource for you. Your takeaways for today: visit the dentist as much as you can before their health declines too badly. Brush and clean their teeth at least 2 times a day. Don't forget about dry brushing. Remember dry brushing. Your hygienist is going to say, what have you been doing differently? It makes a big difference. Clean in between the teeth. You don't want that food staying stuck in there. I showed you a variety of things. Whatever works best for you, just get the stuff out from in between the teeth. Be aware of dry mouth and you use products. Do whatever you can. You will save a lot of heartache in the future if you can control the dry mouth. Same thing, the Xylitol helps with that. Be aware of the foods and drinks. I talked about how you're drinking it. Drink it at one time rather than all day long. Just be aware. pH is very, very important. Keep your loved one comfortable. The more comfortable, you know how good they feel after a shower. They feel that good after they brush their teeth. A clean mouth leads to a healthier body. Now, I know it's hard. I know you have bad days. I know it's frustrating. It's hard. You're not in this alone. We understand. There's no judgment when you come to a dental office. There's absolutely no judgment. All we want to do is help you, and we want your loved one to be comfortable. Just keep swimming. Hang in there. That's for you, Abigail. I said to complete the post survey that won't be mailed to you, but I want to ask you now, how confident do you feel taking care of your loved one's mouth on the scale from 1 to 10? I hope it raised up quite a bit. I hope that you got something out of this presentation. I'd like to thank Dr. Michael Fallon. He has been my advisor and mentor for this program I'm doing for the community dental health coordinator. So I appreciate him. Jake Widrick, he is the director of Marcellus Library. That's where we are now. We're by ourselves. It's just me and Kimberly. And Jake helped us with the technology. And I truly appreciate the Marcellus Library is an awesome facility. And I can't thank Kimberly enough from the Onondaga County Office for Aging to, we worked a long time trying to coordinate this and get this done. So I truly, truly appreciate your help, Kimberly. And thank you. My contact information is on the screen, mbvensel@gmail.com, mbvensel@gmail.com. I'm happy to help in any way I can. I hope that you have gotten something out of this, and I hope that your loved one I hope their mouth feels much better, and I hope you feel more confident taking care of them. Thank you so much.